A new international trial led by researchers from the National University Hospital is offering hope for people living with chronic hepatitis B ahead of World Hepatitis Day with a new treatment known as bepirovirsen. About 1 in 5 patients achieve what researchers called a functional cure. That's when the virus remains under control for at least 6 months after treatment stopped. Patients whose hepatitis B was already well controlled at the start of treatment appeared to benefit the most from the novel treatment as well. While researchers caution that the treatment may not be suitable for all patients, it offers a possibility that the virus can be managed better for more patients without needing lifelong therapy. Now, to help us understand this treatment better, we're joined by Professor Lim Seng Gee from the National University Health System. Professor, hepatitis B has been difficult to cure for decades. Why has the progress been so hard?
Well, it's like trying to determine a problem at the bottom of the sea, 100 meters below the surface. And we're measuring the seawater to find out what's at the bottom. So what's happening for hepatitis B, to cure it, we need to look at the liver itself. And nobody wants to have tissues taken from their liver. Consequently, this has hindered the understanding of how hepatitis B can be cured inside the liver. But this new drug offers hope that actually this is possible.
Now, around 1 in 5 patients achieve sustained control of virus after treatment. Now, in this research, how big a step forward is that, even though it is not a permanent cure?
Well, I think this is a major step because people who are on tablets, who are controlling hepatitis B, have about 2 or 3% chance of curing the hepatitis B after 3 or 4 years of treatment. So a 20% chance of curing hepatitis B represents a substantial breakthrough. And when you say it's not necessarily a permanent cure, the term functional cure means that the hepatitis B is not present in the blood. So for all extents and purposes, patients are considered legally not having hepatitis B. And this is an important advance, not only because there's an 80% reduction in complication rates, such as liver cancer, liver deaths, and liver failure, but also it removes the stigmatization associated with being called a hepatitis B carrier and the risk of transmission to members of your family and your friends.
Now, what would this research result mean for patients in terms of practical terms? Could they kind of replace and stop daily medication, perhaps?
Well, if they have this treatment and is successful, if they're cured or achieve functional cure, then in fact they are off all treatments and they don't need to be on medication at all. And the chance of relapse is extremely low based on the study results.
And based on what I've read, patients whose hepatitis B has already well controlled benefit most from this research. Does that mean early diagnosis and good long-term care are now even more important?
Well, I think, first of all, in order to benefit, you need to have the diagnosis. And the treatment is only approved for those who are already taking tablets or to control the hepatitis B. So this is the group that's going to benefit the most. And they also have low levels of virus detected by a test called the S antigen level. So these are the patients who are most likely to benefit. And so if patients want to have the treatment, they need to go and get tested. If you're not sure you have hepatitis B, go and get tested.
Now, what's the next milestone for this research team now that already you have a functional cure, so to speak?
Well, 20% is not exactly, the most optimal therapy. So our own research team, and we work together with GSK, who has made a drug, to try and improve the treatments available. So our own program also looks to improve cure rates and trying to find out the mechanism behind how this drug works inside the liver, as well as other strategies to try and improve cure rates for patients. And this is all funded by our research grants from the Medical Research Council.
And what would you like to see as the result?
Well, obviously, more than 50% would be good, and clearly a path and understanding how we can improve treatments for patients and identify what pathways are involved in leading to better cure rates is, I think, the objective of our program.
Oh, Professor, thank you so much for sharing this insight on the research that you have. That was Professor Lim Seng Gee from NUSH and NUH. Thank you.